Welcome back to Taking the Pulse, a healthcare and life sciences podcast. I'm Lynnsey Baker, joined with Maynard Nexsen healthcare attorney Lauren DeMoss. Lauren, always good to be with you.
Yes, thanks so much, Lynnsey. You as well.
And thank you also to Sara Howe, with Executive Director of Addiction Professionals of North Carolina, joining Lauren and myself, as well as Morgan Coyner, the Executive Vice President with the Addiction Professionals of North Carolina, which we know internally as APNC. Thanks for being with us here, ladies.
Absolutely. Thanks for having us.
Here.
So obviously you all are doing very important work up in North Carolina. We wanted to dig into that a little bit more. Tell us about the insightful conversation about substance abuse and treatment. Can you start us off by telling us exactly how you both ended up working for the APNC?
Oh, wow. Well, we'll try to shorten this conversation. Morgan and I have very different journeys to this work and this path at APNC. I started as a high school student in a substance use prevention program. I was born and raised in Chicago, Illinois, and was part of a program called the Illinois Teen Institute, which is a leadership development program that is focused on substance use prevention and really building those protective factors and building resilience. So from a very young age, I decided that the work I wanted to do was really build communities and work in that prevention side. So I was really very fortunate. I spent several years running the counterpart to APNC, which is the Illinois Association for Behavioral Health in Springfield, Illinois, and did that for about 20 years. And then I had the great fortune of connecting with APNC through a consulting role that I had. And now it's been 3 years that I've been the CEO of the association, and I've loved every minute of it. So, Morgan.
Yeah, like Sara said, very different stories. I come kind of from the opposite side of prevention, which is I have my own recovery journey, and I kind of got into the addiction field on accident. I was a fundraiser and grant writer and always thought, maybe I would be really good at it if I found a mission I was really passionate about. And so I started working at an addiction treatment center, and 3 months into that job, I lost my mom to a fentanyl overdose. And so I came back to work a week later, and my boss at the time said, "You will either quit this job in 2 weeks and never come back, or you will stay in this field forever and be one of the fiercest advocates for this issue." And it was the latter. After my mom died, I just kind of was like, I don't know what else I would do that it could be this meaningful and also be something that I enjoy and am good at. So at the time I was in Nashville, Tennessee, but my sister was here in Raleigh, North Carolina, and she has 3 little girls, and I could not be a long distance auntie anymore. So I started looking for substance use jobs here in North Carolina and found APNC, and I'm coming up on 4 years in a couple months, which is crazy.
Wow, Morgan and Sara, you obviously come from different areas, but you can already tell, and I'm sure as we talk more today, can tell how passionate you are about it. That certainly comes through. So earlier this year, APNC launched the North Carolina Treatment Connection. Can you tell us a little bit specifically about this campaign and kind of the inspiration or driving force behind it?
Yeah, I'd love to. We're really proud of the North Carolina Treatment Connection and what it does. It focuses in on a problem in our field, which is patient brokering. And I'm thrilled to be able to talk to you today about this because a lot of consumers don't know what is out there. As we've seen the opioid crisis and the epidemic really explode, what we unfortunately see is opportunities for people to take advantage. Right, that's the first thing. So what has happened in the course of the last probably decade or so is unscrupulous, unethical providers that don't provide quality evidence-based care are entering the field under the guise of being a great provider. And what they're doing is oftentimes they will ask individuals to bring people to their treatment center, and they will pay them. So they call them body brokers, they call them patient brokers, but they'll basically give them a bounty to bring somebody to the treatment center. What ultimately happens there is that center is not providing good quality care. What they're really trying to do is just bill as many claims as possible to the insurance company so that they can get those dollars, but they're not providing care on the back end. What this looks like in practical terms for your listeners is individuals who are often already in recovery. Maybe they're working a 12-step program, so they're at an AA meeting, they're at an NA meeting. Somebody will become part of that community, that 12-step community, and then they will befriend individuals and help them along to a relapse and get them to a point where they need treatment again. And then they will say, well, guess what? I have this place and come over here, and they will walk them down the path to the unscrupulous provider. What is happening is these individuals are getting trapped in these facilities. They're not getting quality care. They're using in the facilities. They're overdosing and dying in these facilities. I worked with a mom when I started to get really passionate about this. I met a mom who lost her 26-year-old daughter to a patient broker. She overdosed in the facility. Nobody called her for 3 days until one of the other patients called and said, we think you should know your daughter has passed. And her insurance was billed and paid $1.2 million.
Oh my word.
Wow.
It's stunning. It's stunning. It's disgusting. And what we've found is if you don't know today that you are going to need this resource, you're not thinking about what are the things I should look for, what are the red flags, what are the signs. But I bet everybody who's listening can remember that they've watched some television program where an addiction helpline has popped up in a commercial. And sometimes those are legitimate. Sometimes there's a little fine print at the bottom that says, well, this isn't really a national hotline. It's only for like these 3 agencies. And what we've started to see is as more money is getting into our field because we are seeing an explosion of individuals needing help, the unscrupulous actors are following. So this campaign is to educate consumers. It's to get out of our own field and talk to folks like you about what is patient brokering, what to look like, how do I find the right quality provider. And one of the key pieces here is you don't have to leave your home state to do it. So for us, the North Carolina Treatment Connection says you can get the right help and it's right here in North Carolina. Because oftentimes we'll see these individuals getting pulled to other areas, Florida and California being our biggest culprits. Although unfortunately, we have a wonderful place in our state called Asheville that's a great tourist destination. And now we're starting to see some of these unethical providers pop up there as a, touristy place to go get your treatment.
Mm-hmm. And I would imagine being able to stay close to home would help knock down one of those barriers to care there rather than having to get the funds to then go out of state and deal with all that. Because obviously recovery is a very expensive process, along with being something that takes everything out of you mentally and emotionally and physically. Morgan, as someone who's gone through recovery yourself, how would you advise someone to spot a reputable treatment facility versus a bad actor like Sara was describing?
Yeah, the main thing really is like look for clear communication. So the people who are doing things above board have really clear statements on their website about who they are, what they do, what to expect when you get to treatment, what the requirements are. They've got information about what sort of therapies they provide. They've got information on like their location. They've got pictures of the facility, and it's not, you're not seeing ocean waves for a center in Greensboro, North Carolina, because there's no ocean there, right? So making sure that things, it sounds very common sense, but making sure that lines up. And you want to be wary of kind of bold promises. I think in this day and age, we're very used to bold marketing promises and many people at many companies telling us that they can fix us or fix our problems. But most reputable treatment centers aren't telling you that. They understand that addiction is a chronic relapsing disease, that people may come in more than once. So they're saying, like, we can help you on the journey. We can help you find recovery and grow in recovery. It's not the message of like, we're going to cure you, you're going to be fixed forever. The language is just very different. And I think the other thing to keep in mind is people are navigating this in a moment of crisis when they're not really able to sort through all that information. And that's why we really want to be telling people now, hoping that whether it is the person in need of help or a family member can have access to this information so that when the crisis comes, they then are already equipped to ask those questions.
Because it's a very overwhelming situation to be in. Obviously, not only addiction, but if you finally have come to a point of like, I need help, and where do I start?
Yeah. And I think too, like the good thing about treatment in North Carolina is we want these people to stay in North Carolina long term. We want them to continue to be productive citizens of our state. And that really is only going to happen if they maintain community when they leave treatment. And so it's not very helpful to send someone to Florida, have them get this great recovery community, and then put them back in North Carolina, which is the place where they've found addiction, and then completely remove them from their community. Like, like it's not setting them up for success. So when we talk about keeping people here, it's also about making sure that we're building the communities that can sustain their recovery too.
Yeah. So Morgan and Sara, aside from the patient brokering problem, what are some of the other challenges facing behavioral health, substance abuse treatment in North Carolina? And I realized too, I asked about North Carolina, obviously that's where you are, but some of these challenges may be, no matter where you are. So what are those? And then maybe some that you might see specific to North Carolina.
Yeah, I would say, I don't know that any of them are really specific to North Carolina. I have to think about that. But the field itself has had a workforce crisis for a while. And I know there's a lot of fields, and you talk about taking the pulse of healthcare. I'm sure you've talked about this a few times. Post-pandemic, we saw a lot of individuals that left our field and went somewhere else. Look, the bottom line is when you start talking about the work that we do, there's grief involved in this work. It's heavy work. It impacts you emotionally. You have a lot of joy in seeing people build their lives back, and that's wonderful. The funding hasn't always been where it needs to be. So you're not getting paid. You're not making a whole lot of money, which makes it hard for this workforce to continue to do this work when it can be so difficult. So burnout is probably one of our biggest challenges while we're seeing the higher acuity, the higher needs of individual patients. There's some joy. What we've also seen is our work is having an impact nationally. The CDC has shown a decline in overdoses. North Carolina led those declines. So that's a huge piece for us. They have leveled off though. So we're not continuing to see them go down, they're leveling off. And in communities of color, they didn't decline. So we do still know that we have work to do. So there's joy and there's hope, but there's more work that we have to do. Morgan, I don't know if I've missed anything that you would add.
I mean, I think the big one that you're almost like getting to in that is it's stigma, right? Still, it's hard to get people into treatment when people in their families don't believe in treatment, or they don't believe that addiction is anything outside of you make bad choices because you're a bad person. It's a disease, right? And we're still fighting that fight out in the main general public world to get people to understand that it's okay to ask for help and it's okay to need help. And so even though we have some really great quality treatment providers here in the state, we also know they're not always full. And they're not always full because there's a lot of barriers around stigma, but insurance, around transportation, right? Like we could kind of like go all the way out, but not everyone is able to access the help. And so trying to figure out where those barriers are and removing them, I think has also been a pretty strong push in the field over the last 5-10 years to make sure, okay, well, we've got the treatment down. Now we have to figure out how to get people to it.
Yeah. And the stigma one, you obviously have the outside barriers, like you mentioned, some of the insurance stuff, but then helping someone kind of, if they have if they kind of, aren't willing to, or the stigma is really, getting that out of the way for folks so they can access is a huge issue. And Sara, to your point, yes, we have certainly talked about lots of workforce shortages, just in the healthcare industry generally, but COVID and the pandemic made a difficult industry even more difficult, right, for folks. And I think, employers are seeing folks threw their hands up and found something else, or couldn't quite handle it still. So yes, the workforce challenges, I think, are across the entire industry.
And just the burnout that y'all were mentioning. I mean, and the emotional tie when you get connected with someone and you really believe they're capable of recovery, and then the disease progresses and they relapse, and that personal connection you've had, and then feeling like you mentioned, Sarah, like you have that really exciting chapter when that person has been able to turn their life around, like Morgan, but then the sadness and immense, I don't know, depression that comes along with when a client isn't able to do that for themselves.
Yeah, we've done as a field, we've really tried to work with some grief resources for our field, some opportunities for people to make sure that they take care of themselves. A good portion of our field, I would say probably 40 to 50% of our field comes to this from their own recovery journey or their own family journey. Maybe they themselves aren't in recovery, but they know a family, they know a friend. So that's also for somebody who's in recovery and in this work, then it's really critical to make sure we're also protecting them. We're giving them the well-being resources that they need, because they do see that same joy and also potentially that same grief as things change and shift over time in a client's life.
Morgan, you said something that really struck me, and I wanted to go back to that point. You were saying, it doesn't really help us keep this person in recovery if they go to another state, find their resources and community connection there, and then we transplant them back to the state where the problem was, and they've lost their entire community connection to this new path of recovery. So the model that you all have started there in North Carolina with your North Carolina Treatment Connection, could this be easily replicated in other states?
I think so. I mean, it's just a matter of, when we think about North Carolina Treatment Connection, it's actually a very simple idea, right? It is one location where you can find all the information you need. We partner with a great organization, the Alcohol Drug Council of North Carolina, who has a comprehensive database of all the treatment centers and recovery homes and all the different resources available for individuals in need. And North Carolina Treatment Connection is really just another hub where we've got that information that they can access through both that local North Carolina organization, but also places like SAMHSA and some national databases. And so when you think about it in that sense, I think it's pretty easy to replicate. I think the piece that becomes more difficult is getting into the weeds of like, okay, so then what's next for the campaign? So there's this hub website, great, but then how do you continue to engage and educate the public? And so while all of that I think could be replicated, I think it would look unique state to state in terms of the fact that every state has its own very specific culture and demographic.
And when you say that, Morgan, I think the other thing, in North Carolina, we have a law, it's called the SAFE Act, it's the Stop Addiction Fraud Ethics Act, and it made patient brokering a Class G felony in the state of North Carolina. There's about 20 states nationally that have some type of law. So when you talk about replicating this in other states, the first thing is to go back. One, do you have a similar law? What does that look like? How do you educate the public on what to do if you think you've been a victim of patient brokering or a family member? If you don't, Congress passed a law in 2016 and 17, I believe, called the Eliminating Kickbacks and Recovery Act, or we call it ECRA. So there's federal legislation, and then state legislation would layer on even some more penalties, which I think is important if you talk about across the country. Let's first start with making sure patient brokering is illegal. Let's find out how we get these people off the streets and out of our community so they're not doing this. And then the next piece is a law is only as good as the education of its consumers about it. So those three basic things you absolutely can start with. And then what Morgan was saying, the next piece is that public education, that public consumer outreach piece that we do.
So as we kind of wrap up today, Sarah and Morgan, tell us what's on the horizon for APNC. What's next? What are you looking at, or what are your goals kind of over the next several years?
One very specific thing related to this campaign is really bolstering our providers who are the ethical and reputable treatment centers to one, be in compliance with the law, but that's really just, the bare minimum, but getting them to really have a presence in their communities and be not just a reputable center on a website, but a trusted resource in their communities, I think is a huge one when it comes to this campaign specifically.
The other thing I was going to say is we're really excited about what we really believe our job at APNC is to make sure our field is prepared for whatever changes are coming next. So we have just launched a Center of Excellence for Gambling Addiction Policy and Practice here in North Carolina. Unfortunately, as we've seen around the country, gambling has exploded. Online betting, sports betting. It is now the most accessible addiction. I could actually be placing a bet while I'm talking to you all right now. So when you think about that, from our youth, I go back to the prevention point of view. I was a kid in sports. One thing I didn't know was the money line on every game I watched with my dad. But a 5-year-old now does when they're sitting watching something. What does that do to our brain? What does that look like? How does it change our entertainment? How do we do some prevention work so kids are more resilient? And then if people need treatment, you go back to what Morgan was talking about with stigma. We want to talk about substance use stigma. Let's add gambling. And let's talk about how hard it is to make that call. Oftentimes, they have lost everything, and it has the highest suicide rate of any addiction. So in North Carolina, we want to dig in and start talking about it now. And so we're not turning around 5 years later, sort of like we did with the opioid crisis and watched it explode and then said, what do we do? We want to talk about this now and prepare our communities and our providers for how we can be a little bit more resilient, because gambling is not going away. We know that.
It's just getting more and more accessible, if anything.
Accessible and acceptable.
Right.
And the data's harder to come by, right? It's like we have to look at suicide rates and kind of peel that back. We have to look at, people filing for bankruptcy, or there's not just with addiction, we say, okay, there's an overdose rate and we track that. And of course, it's much more nuanced than that. And there's so much more that we track and that plays in, but there's no overdose rate for gambling. So how are we even identifying these people in the first place and making sure that we actually have a pulse on what's happening now so that we don't let it get worse?
We don't have a great system right now across the country for gambling treatment and gambling recovery resources. So if you go back to our conversation about North Carolina Treatment Connection, today I couldn't do a gambling treatment connection resource because I don't know where I would send people. There's maybe 2 in North Carolina I can think of right now. So we need to build out that infrastructure, and we need to do this across the country. And let's start thinking now, while we know things continue to build and we continue to see more and more, like you were saying, Lynnsey, acceptable, more proliferation of gambling, so that we can have that treatment connection ability and those recovery resources into the future.
Sara and Morgan, as we wrap up here, someone watching might know a family member that struggles with addiction or gambling and really needs some extra assistance. I believe you all have a podcast. Where could someone turn to listen to hear more from the both of you?
Yep, we have a podcast. It's called Connections by APNC. And we're about actually to launch season 3 next week, which is exciting, here in mid-July. So it's kind of covers the gamut. There's things for professionals, there's things for individuals who may be struggling, for family members, but it's a great way to learn more and educate yourself. I always tell people when they're trying to figure out how to support someone they love, learning about addiction is one of the most helpful things you can do, because it helps with that whole, I don't know what to say and I don't know how to act. And the more you know about it, the less you're worried about, oh no, what am I going to say? Because you kind of start to understand what someone's going through and have empathy. So I think listening to some of those episodes might be really helpful to give perspective around what addiction really is.
The other thing, Lynnsey, I would say, so North Carolina Treatment Connection, nctreatmentconnection.com is our website. Whether you're in North Carolina or not, it has information on how to find a good, reputable treatment provider, how to sniff out what are some red flags. So that is education nationwide. And also on there are 3 resources. One is very specific to North Carolina, the Alcohol Drug Council of North Carolina. There's two others. There is another one is the North Carolina Department of Health and Human Services. So they're again going to give you North Carolina specific. But also on there, front and center, is what Morgan referenced, which is called SAMHSA, the Substance Use Mental Health Services Administration, the federal government. They have a treatment locator, findtreatment.gov. If you go to nctreatmentconnection.com, even if you're in Iowa, you can go on there. You can go to that SAMHSA section of the website, click in there, and it will help you find treatment in your home state. So anyone can do that and at least try to get the resources and get a little bit educated on what they should look for in their home state.
Well, thank you both for bringing the resources. Thank you so much also for not being burned out and bringing the passion to your field and helping countless people there in North Carolina and even beyond through this podcast and through your own podcast. We appreciate your time here today with me and Lauren. And Sara and Morgan, we wish you the best of luck in your future endeavors for sure.
Thank you.
Yes, thank you, ladies. All right, and that's all for us here today, but we'll see you next time on our Taking the Pulse podcast.